living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
America is facing an opioid epidemic as more than 100 people die from an opioid overdose every day. That number would likely be higher if it wasn't for a life-saving drug that can reverse the effects of an opioid overdose. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we continue our discussion about opioids by learning how one drug is reducing overdose deaths and how to get help for opioid addiction. Stay tuned. Welcome back to Healthy Living for Life. Last week, we talked why opioids are addictive and the part you can play in keeping them out of the wrong hands. This week, we look at other aspects of opioid addiction and helping people who are at risk or who are in need of treatment. We start this morning with Lisa Sather, Director of Pharmacy Services for Mountain Pacific Quality Health. Thanks for being here, Lisa.
Thank you, Beth.
So what is naloxone and what does it do?
Yes, great question. So naloxone, also known as Narcan, is an opioid antagonist. That means it works, you know what antagonist means, it works against something, so works to counteract the potential life-threatening respiratory depression that can occur when somebody has an accidental opioid overdose. It basically helps to knock the opioid off the receptor, and it helps to restore someone's breathing and gets them back to breathing normally again for a short period of time.
Is it new, or how long has naloxone been around?
Yeah, so I actually didn't know the answer to that, and so recently I looked that up, and it actually is not new. It was patented in 1961 and was approved to treat opioid overdose in 1971, but it's really intriguing because we are obviously seeing an increase in utilization and availability of this life-saving medication in the midst of the opioid overdose epidemic that we've been faced with this last several years, last decade.
So you talked about this a little bit already, but so how does naloxone actually work to antagonize that opioid overdose?
Yes, that's a great question. So, chemically speaking, opioids bind to opioid receptors in the brain. We've talked about that on a previous show. And what happens in an overdose situation is you have too many opioid receptors being occupied, and that obviously can cause what we talked about, which is decrease in respiratory rate, decrease in heart rate, all those kinds of things that go along with it. What naloxone does when it's administered, now again, it has to be used when somebody has an opioid in their system, but it goes in and it basically likes those receptors more than the opioid itself. So it's able to knock the opioid off those receptor sites so that basically the big side effect we're talking about, which is respiratory depression, somebody can then start breathing again on their own and then get emergency treatment right away. It's important to mention it's temporary, so but it has a higher affinity, we call it, for those opioid receptors than the opioid does itself.
Okay. And so obviously if someone is overdosing, that is a serious situation.
Absolutely.
And it's not something they can give themselves. So
Right.
How does someone get naloxone? How is it administered?
Right, so it's really kind of cool because naloxone is available in a nasal spray formulation. So that's pretty easy for someone else, like you or I, to give to someone who has a suspected overdose. It's also available to be given in a muscle, so intramuscularly, or by trained medical professionals in an IV format. They can draw it up in a syringe and give it directly into a vein. The nasal route's pretty cool because it works pretty rapidly because your body doesn't have to go through some of the absorption characteristics it would normally have to do. Normally, in the past, the administration, when it was available IV, was really limited to your healthcare professionals, but with the nasal formulation and even the intramuscular injections, that can be administered by a layperson. And so, it's really important if you have a family member or a friend that potentially is at risk for having an overdose situation, that they learn how to use it.
So if a person is on a high dose of an opioid, should they have naloxone around, or how does that work?
Yes, so there are certain risk factors which predispose someone to potentially having an overdose. I mean, even if you're on a stable dose of an opioid, but it's a high dose. Let's say a different provider prescribes you something that might interact with that might increase that respiratory depression that we've talked about. You could be at risk. So there are numbers we kind of look at that would predispose someone to being more at risk. So it's important to have naloxone around for the higher dose. But a couple of other things I want to mention that also predispose someone is if they're taking a benzodiazepine-like medication. Those are typically sedative medications. If they have a history of a prior overdose, accidental or otherwise, if they have a history of a substance use disorder, if they've been treated for a substance use disorder for opioids, and they're at risk for potentially returning to a dose they were tolerant to before, it's really important to have naloxone available to them.
So is naloxone prescribed then? Always? That's how you get naloxone?
So that's a great question. So it used to be a prescription, and basically it used to be available only if your physician wrote a prescription for it. That's still a way you can get it. But in 2017, Montana passed legislation which allowed what we call a blanket prescription for naloxone to be available throughout the state of Montana. It's still a prescription product, but anyone that has a family member or a friend or someone that they're concerned they might be at risk, you can go to a participating pharmacy, a pharmacy who carries it, and get a prescription. It'll be in your name for naloxone. So that's awesome. It's really increasing the availability throughout the state and helping us combat this overdose epidemic that we've been faced with.
That's great. And so the big question is it saving lives? Do we know that naloxone is really reducing overdose deaths?
Yes, we do know that is happening, absolutely 100%. What we don't know is we don't really have any hard data yet on what those numbers look like, but there are lots of instances happening right now where it is in fact giving people that safety net that they are able to have another chance.
Okay, perfect. Thanks so much, Lisa, for
Absolutely.
all that information. We do need to take a break here quickly, but providing naloxone to patients who are prescribed opioids is just one way this drug is saving lives. We'll learn about another way right after this. Don't go away. We'll be back in 2 minutes. Stay with us.